Well, that's a very good question. In the UK, the plastic surgery procedures are typically priced at the same level at other countries in the first world or the developed world, and around Europe and in the US. Um, Usually, the prices are dictated by the market, and they are average prices compared to other countries in the same region in Europe. Um, However, it's not just the price that we need to be looking at, it's the cost of things rather than the price itself. Like anything in when you buy anything in the market, you're not just looking at the price, you're looking at the cost that you're getting, or the product that you're getting with the price. So even though it may be a little bit more expensive compared to other countries, and maybe in the Middle East, or maybe in far end Europe, like in Turkey, for example, it may be that the cost that you get is related to the higher products and the quality of the service, the this post-operative care. So these are the things that will dictate the prices rather than just as a raw price that you say. First of all, that we need to understand that the plastic surgery or the cosmetic surgery, part of it is not funded by the NHS. So although you may get some of your healthcare that is covered by the NHS, which you don't pay for, but what is happens in the ground that in the background that we don't see is that the NHS costs a lot. So any price of healthcare anywhere in the world costs a lot because of the materials that we use, because of the products that we use, and because of the expertise that we develop, as well as the expertise that involved. So if we look at a procedure in the private practice per se, when it's not really funded by the taxpayer, you as an individual, you'll be paying for the services, the materials, the consumables, the hospital stays, the hospital fees, the anesthetic fees, the surgeon's fees, and the allied healthcare professionals like the nurses and other allied healthcare professionals that will look after you during your procedure, and all that you will be funding it rather than state funding it, and that is accounts for a very high price. Although we're not naturally or not usually accustomed to that, because in a state funded healthcare like the NHS, for example, or in cases of the in cases of insurance funded and healthcare, you don't really see the bill, in the bill for the health service that you have, or that it's provided to you. But in the private practice, you actually see that bill, you have to pay that bill yourself, which can account to a significant number, of course. Um, the other important thing is it's the quality of the service that is provided to you, especially in the UK, is a very high quality in terms of regulatory bodies that will regulate the hospitals, like, for example, the CQC, regulated bodies that regulate the marketing behind the private practice and the cosmetic surgery in particular. For example, the cosmetic marketing agency, as well as the GMC, regulated bodies that will regulate the surgeons and the healthcare professionals looking after you, including the General Medical Council, the GMC in the UK, and other bodies that the surgeons, and especially cosmetic surgeons, will be affiliated to, for example, the Royal College of Surgeons, the in particular, for example, in the case of plastic surgeons, the British Association of Aesthetic Plastic Surgeons, the BAPS, or the British Association of Plastics and Reconstructive and Aesthetic Surgeons, the BAPRAS. And other organizations that will ensure the high quality that you will be provided. And that all costs come at a cost, of course. That is a very hot topic nowadays, and I understand a lot of people look at going abroad, um, looking only at prices to get the best deal for their cosmetic surgery. But this has a very dire complications and dire risks that we see every day when this happens. Unfortunately, when you go abroad, it's not just the price that you see, that's the price tag that you are given, or the invoice that you're given, that is much lower, that maybe at the first glance it's lower than what you will get in the UK. But what you don't see is the hidden price and hidden cost behind this. Costs of traveling, costs of staying in a hotel, costs of risks and complications that may develop, and they do develop. And we see horrific results coming from such clinics abroad, and the cost of trying to set things right. And more importantly, we sometimes hear stories of actually loss of life, which you can't put a price tag on. So, in essence, going abroad to have a surgery is not per se wrong, but what you need to do actually look for is to look for how long you're going to fly for, where are you going to stay, is it a regulated facility that you're going to have your surgery or your procedure in, have you seen your surgeon, have you had time to consider your options and the risks and complication, has someone honestly and thoroughly explained to you what the procedure is, what it entails, what the risks and complications available with that procedure. And like any other procedure, there's no risk, there's no such thing as a risk-free procedure. Any invasive or even non-invasive procedures have some risks and complications that need to be conveyed to you honestly and with a qualified health professional. Is that surgeon or that healthcare professional, is he registered in the corresponding bodies in that country? Is he renowned? Does he abide by the rules and the laws of the healthcare professional in general, or in that country in particular? Are you provided with a follow-up care plan? Are you provided with a post-operative care? Are you provided with information if things go wrong? What should you do? Who to look for? Who to contact? Where to go? Are you provided with a post-operative or a plan for when things go wrong, how to set it right? Is there a package for having revision surgery? What happens if things go wrong, and what should you do? All this, do you have the available insurance? All this have to be discussed before you take that step. Nobody can tell you not to go, but this needs to be considered, because a lot of people don't tell the patient or the client in that case, is that if things go wrong, and sometimes they do, even with the best surgeons in the world, if things go wrong, what should they do? And more often than not, We see them stranded, not knowing what to do, and they finally go back to the NHS to get things right. But unfortunately, according to the NHS rules and according to the Care Commission guidelines that said what can we do in the NHS, unfortunately, correcting things after aesthetic surgery or cosmetic surgery abroad is not covered by the NHS, and thus you'll be left to only do the life saving procedures and to get you to a normal and healing level, but then they will not set things right, and you'll have to pay an extra price to set things wrong correctly. And more importantly, we hear a lot of stories about what we call botched surgery, and a lot of people might have heard this. And there's a lot of stories that are not expressed in the public or expressed in the news, and what we see in the news is just a tip of an iceberg. What we deal in the NHS is we deal with horrific stories that unfortunately they look for the cheaper option, but they end up by paying a very high price, and that's the reason why. That is a very important question. First, prior to your procedure, you need to discuss with your provider, with your surgeon or your clinic or a hospital, what are the process in place and what is the terms and condition for those surgery, for that process, for that procedure. What happens and what should I do if things go wrong and if you've got any concerns? Who should I contact? Will it be covered to fly back to you to see you? Will it be covered to stay in hospital or in a hotel for an extended period of time? And also, you need to understand from them what is their insurances and what is their qualifications to be able to do this procedure. Now, God forbid, in case that you develop a problem, you need to be able to contact your primary surgeon, the place that you already had the surgery or the provider, ask them for advice, see how they can provide help, and then act accordingly. And unfortunately, in the common things or common thing that happens is that what we see is the client or the patient at that time develops a problem. They contact that surgeon, who unfortunately either wouldn't speak in English or the provider would not be able to help them because they're far away, and they'll ask them if they can pay for the flight to come. And that can be very, very dangerous, because if you've got a problem, any health problem, you shouldn't be flying. So that can cause a huge significant health risk. And the other thing is to go to the NHS if it's a life-threatening problem, or if it's a significant infection. And in that case, unfortunately, most of the time, maybe you'll be able to set things right and save your life, but more importantly, they will not be able to set things right back to where it was before or where you want it to be. And you will have to go to private practice, to seek private practice in the UK to be able to correct things if things go wrong. And unfortunately, that will come with a price. And more importantly, it can be very difficult for a surgeon to set things right from a second time when things gone wrong, rather than start from a blank canvas and do things right from the first time, which we are trained to do. So this is a very good question, although it's quite difficult to run by all plastic surgery procedures or cosmetic procedures. However, what we know is the price and the cost of plastic surgery across Europe and the developed world is very, very similar. most plastic surgeons, most renowned plastic surgeons, qualified plastic surgeons, and certified plastic surgeons across the world will usually have a typically same range, depending on your geographical area, depending on your circumstances, depending on your the complexity of the procedure, depending on the surgeon or the provider. So it can vary a range, but what we can say is that usually with a qualified plastic surgeon and a regulated healthcare provider and a reputable service will always be at the top range. So it will be almost a very similar price and across the range. What you don't want to find a very significant reduction in price in a certain procedure compared to others. Because if you find a significant reduction in price compared to the general market, then you have to ask yourself a question: why is that reduction in price? Is it a lower quality of products that have been used? Is it a lower quality of a surgeon, less experienced surgeon doing the procedure? Is it an unregulated hospital that's performing the procedure? Is it a regulated provider? Because having said that, we need to understand that regulations and abiding by the rules and regulations and qualifications, they cost. Products and high quality products, they cost. So if you get a procedure that is significantly less compared to others, then they have cut the price somewhere in that loop. And you have to really, really question what and why was that price cut. It can't be in thousands, maybe in hundreds, but that's fine. So a range of hundreds, that's okay. But in thousands, you really need to raise your brow and ask, why is that happening? There has to be something that has been omitted, something that is used less quality or not regulated enough that is used for that procedure or during that healthcare service. And that is an important thing to think about, because you don't want to cut short and you don't want to cut corners with your health. It's the same thing that if you go buy a mobile and you expect to get a smartphone with a certain price, you look at different manufacturers and different providers, you'll find a very similar range of prices for a range of products. However, if somebody's coming to you and telling you, I can give you a smartphone with a significant price reduction, you will raise your brow. It will beg a question right away. What is that? Why is it such a significant reduction in price? And then you wouldn't do that with a smartphone, something that you would pay. And I think we should not do that with our health as well. That is a very, very important question. How to choose a plastic surgeon is a very important question, because there are lots in the market and it can be mind-boggling to choose one. The first thing that we recommend is to look on the sites that regulate those surgeons. So you can choose a surgeon that is experienced. So you can ask your surgeon about his experience, and you should get an answer for that, and a clear one. You are allowed to inquire about his qualifications, his training, his years of experience, how many surgeries he's done of that particular procedure. You can go online on the GMC website, which is the General Medical Council, and check the registration for that surgeon. Is he registered with the General Medical Council, which regulates every person that practices medicine or surgery in the UK? Is he on the specialist registry for that discipline. So if if you are doing something for your head and neck, is he a plastic surgeon or is he an ENT surgeon, or is he an oculoplastic surgeon? Is if you're doing something for your breasts, is he a breast surgeon or a plastic surgeon? So is he on these corresponding specialist registry for that? Second, has he or is he at the moment a substantive full-time consultant or a substantive consultant? Doesn't have to be full-time, but a substantive consultant in the NHS. Has he held that post or in the past, and he maybe quit the NHS, or is he currently in the NHS as a full-time or a part-time substantive NHS consultant? The reason we say that is because NHS consultants or the consultants in NHS, they go through a rigorous process to be able to attain that title. Is he affiliated or is he a member of the major organizations and regulatory bodies for his practice or for his speciality? So is he part of, for example, in plastic surgery, is he part of the British Association of Aesthetic and Plastic Surgeons, the BAPS? Or is he as a member of the British Association of Plastic and Reconstructive and Aesthetic Surgeons, the BAPRAS? These are the two major regulatory bodies and organizations that regulate plastic surgery and overlook the training for cosmetic and plastic surgeons in the UK. Is he a member of the Royal College of Surgeons? Does he have a did he obtain the cosmetic certification scheme that is rolled out by the Royal College of Surgeons? So all in all, you have to look at his qualifications, his experience, and you can ask these questions. You need to look. You can look him up in these websites. Also, you need to ask, where is he actually providing the service? Is it a CQC regulated facility? Because in the UK, you should not. Well, in the UK, it's a criminal offence if you give do a procedure in a non-CQC regulated facility. So it is by law that he has to abide by this. So if the facility that you're going to do the procedure, is it regulated by the Care and Quality Commission in the NHS, and sorry, in the UK? It's an independent body that looks at the quality and the safety of these facilities. The other thing that you need to look at is you need to ask yourself, am I being pressured into having this procedure? Is that surgeon pressuring me in any way or form to have the procedure? And if that's the case, please do walk away. There will be no surgeon who's been trained and well certified in the UK will pressure you into do a procedure. Is that surgeon telling me that this procedure is an easy fix and a quick fix and it's a risk-free? Any surgeons would use these again. Any certified and well-reputable surgeon in the UK will not be using these phrases, and they will be completely honest with you about the risks and complications of what you are having. The most important thing to know about is that there is no such thing as a risk-free procedure or a pain-free procedure. Most procedures will have some risks, whether low risk or significant risks, and these need to be conveyed and explained to you. Is the surgeon rushing to do the surgery, or is he giving you time to think? Is he allowing you for at least a 15 days cool-off period where you go and think about the procedure, read about the procedure, have a real discussion with yourself, whether with your family or with your loved ones, about this procedure, whether you want to have it done and is it good for you or not? Go and read for patient information leaflets that will be provided. It should be provided for you by the facility or by the surgeon at the end of the clinic or at the end of the conversation. Is he having a full consultation with you, or is just a phone consultation? Is he actually going to be performing the surgery, or are you meeting someone that is not going to be performing the surgery, and you haven't met the surgeon unless on the day of the surgery, which can be very, very risky. So all these are important. How to choose your surgeon. So the way to think about it is choose your facility, your clinic, the surgeon. Is he qualified? Is he certified? Is he experienced? Can he answer these questions? Does he allow you time to think? Does he give you a full disclosure about the risks and complication about it? Does it give you a good consultation to listen to you, to listen about your concerns and discuss with you what he will be doing? Is he going to be the person actually performing the surgery? All are these the questions that you should be asking your surgeon, and you have to have an idea about the answers and get a good answers and clear answer from your surgeon about this before going into procedures.